I'm James Cusack. I'm the Research Director for Autistica. I thought I'd tell you a little bit about what's got me to being the Research Director for Autistica today, so you know a little bit about my background. I'm an adult with a diagnosis of autism. I have a background in working in autism research and have worked with people with autism a lot throughout my career. So the reason that I joined Autistica is because they really share a similar vision to me, which is to ensure that people with autism and people affected by autism can live longer, happier and healthier lives, which is to ensure that they have the same opportunity as people without autism to these outcomes. So Autistica is the largest autism research charity in the UK. That said, autism research in the UK is, in my opinion, very much underfunded. Relative to the total cost of autism, the spend on autism research is 0.0125% of that. So it sort of shows how much investment there really is within autism research within the UK relative to other spend. Our research strategy is based on what's important to the community. There's research to show that research spend is not necessarily aligned with that. So on that basis, we fund 3 areas, which are aging and adulthood and autism. So research shows that spend is considerably low, and they're in spite of the fact that they represent a considerable population of people affected by autism, and we know very little about how autism functions in adulthood. We invest in research on early intervention in autism. So when we spoke to the autism community, they consistently told us that once you get a diagnosis of autism, there's very little in the way of evidence-based support there. And I think that that's something which has really came through very strongly today when I've heard from many of your contributions. And then the final thing, which is most relevant today, is mental health in autism, which is to suggest that when you speak to people with autism and affected by autism, and you speak to parents of people with autism, one of the consistent things that they tell you is that although the core symptoms of autism do cause challenges, perhaps one of the biggest challenges which people with autism face is the additional mental health problems which come with autism. No, wait a sec, let me see if I can get this right this time. So I think at this stage you're all fairly familiar with the facts. It's not a particularly positive story, and as many of you have highlighted, 70% of individuals with autism have a mental health condition and 40% meet criteria for over 2 conditions. The outcomes of that are quite stark in terms of quality of life. A research study from Sarah Cassidy a couple of years back showed that 2/3 of people with autism and no intellectual disability have suicidal thoughts. A research study from Sweden, which was out last year, showed that people with autism and no intellectual disability are 10 times more likely to commit suicide. I don't tell you this information because I want to tell you this information. I tell you this information because as an outcome, this is shocking, but it's an outcome which we really need to be focused on changing. And for me, the key to that is to develop research which can help us understand these mental health problems in autism and develop treatments and processes for tackling those issues. So I wanted to really give you a bit of a picture of what the community said about mental health and autism. 3/4 of adults with autism told us that dealing with stress and anxiety was their top priority, which really gives you a window into what it is on a day-to-day basis that people with autism find difficult. And the outcomes of that are fairly clear when we sort of reel out all of the negative statistics, which I know are commonly talked about within the context of autism with regards to employment outcomes. So we know that only 15% of people adults with autism are in full-time employment. And it's things like this which are significant barriers to achieving the outcomes which many adults with autism want to face. 66% of adults have tried treatments with no scientific backing. You know, it's not any other medical condition. The idea that this would be happening would be an absolute scandal. So the idea that this is happening within the context of autism is, in my opinion, not acceptable. We need really good research to support some of the interventions, treatments and supports which people with autism are being exposed to. 60% of parents and adults on the autism spectrum have told us they have concerns about using medication. So there's a real consensus there and an opinion that what really the autism community are looking for is non-pharmacological ways to support people affected by autism in terms of their mental health problems. I thought I'd tell you also a little bit about a process at this stage which we're doing at the moment called a James Lind Alliance Priority Setting Partnership. And it's a well-validated process which Autistica is leading in partnership with people like the National Autistic Society, the Autism Alliance, all the local autism charities, and many other groups of people. And basically it asks the autism community to submit their top 3 research questions. Those questions are then summarised into a list of questions, and the top 40 most popularly submitted questions were sent out again. So I've just had the results of that survey back, and the most popular question from the whole autism community was, what are the ways to help me deal with my anxiety in autism? So it really does show you that there's a continued consensus that this is an issue which people with autism and parents with autism and professionals dealing with autism are identifying as an issue. Another popular question was, how do I deal with my mental health problems, and what are the interventions and support to inform this? So rather than me telling you my opinion, I thought I would really share a few opinions of other people. So this is Mike Fitzpatrick. He's a GP, but he's also a parent of an adult with autism. And he says, the thing that would make the biggest difference would be mental health. We're beginning to know what ordinary people need to be well, and we need to know if that's different for people with autism. So it really does show you there that we need a tailored approach for potentially dealing with mental health problems and autism, and that's something which Emily Siminoff has discussed earlier, and it's been a continued theme throughout the discussion today. And again, when you speak to individuals with autism, they say, I would like more interventions for anxiety and other common mental health problems as related to autism and my needs and my strengths. And again, here's another really good quote, which says, my son is not able to work and is not able to sustain a family of his own, but he could sustain a good quality of life in the community, look after himself, get out about, engage in society. These are outcomes that he's not able to achieve at the moment, but he might be able to achieve those outcomes if his mental health problems were adequately addressed. So that's a really good window into how the mental health problems and autism are, substantially affecting quality of life. I'm now going to embarrass someone in the audience. So this is Hannah Picard, who's our Autistica-funded research, postdoctoral research fellow, and I think she really gives us a good idea of why research is so important for understanding mental health problems in autism. She says, my brother has autism, and I can see the small things he battles with on a daily basis with his anxiety. Research into this area will really help alleviate a lot of the problems, a lot of these battles for him and for my parents. And so, in order to address this as an issue, we've committed to a program of research on mental health in autism. We're going to fund we've funded 4 doctoral fellowships at the Institute of Psychiatry and 1 doctoral fellowship at the University of Warwick. We're going to understand questions such as what treatments and interventions work well in social anxiety disorder and autism, what are the environmental factors which lead to mental health problems in autism. Can we understand some of the chemicals in the brain which lead to mental health problems in autism and other comorbidities? At the University of Warwick, Richard Hastings is undertaking a programme of work with his colleague Autistica-Mental, I don't know, I always get that wrong, and a PhD student there to understand mental health problems in autism and intellectual disability. We're also funding a tool for the treatment of anxiety and autism through Emily Siminoff, who you heard from earlier. And hopefully this can develop a process for having tailored treatments for anxiety in autism. Recently we released a report which has gained widespread media coverage explaining the tragic mortality crisis in autism. It's not an issue we discussed lightly, but we hope that in making clear the extent and the tragic cost of mental health problems in autism, that policymakers will begin to inform and properly investigate early death in autism and some of these tragic outcomes. And so we're working to convince government to more accurately track outcomes in autism, as well as early death in autism as well. Finally, the key to understanding autism is participation in research and getting people involved in research, which is why we funded 2 cohort databases, one in children and one in adults. The idea here is that the more people we have in research, the more we can understand about people affected by autism. So we funded these databases through Newcastle University, and I'd encourage you to have a look at those and potentially sign up if that would be the sort of thing you'd be interested in. So thank you very much for your time, and do send me an email if you have any further questions.